Good afternoon, everyone. Welcome to the Cape Cod Commission meeting of August 4th, 2011. I would ask the secretary to call the roll, please.
Barnstable Royden Richardson.
Present.
Bourne Michael Blanton.
Present.
Brewster Elizabeth Taylor. Present. Chatham Lynn Pleffner.
Present.
Dennis Richard Roy.
Present.
Eastham Joy Brookshire.
Present.
Falmouth Mario Di Gregorio. Harwich Robert Bradley. Mashpee Ernest Virgilio. Orleans Leonard Short. Provincetown Austin Knight.
Present.
Sandwich Joanne O'Keefe.
Present.
Truro Peter Graham.
Here.
Wellfleet Roger Putnam.
Here.
Yarmouth John McCormick Jr.
Here.
County Commissioner Mary Pat Flynn.
Present.
Minority Representative John Harris.
Here.
Native American Representative Mark Harding. Governor's appointee Herb Olson. We have a quorum.
Thank you. At this time, if there are members of the public that would like to address the commission, it would be a good time right now. It's time for the public comment period. So anyone wishing to address the commission? Seeing none, I would ask for the executive director's report, please.
Thank you, Mr. Chairman. I have two things for the commission today. One is just to remind you, we started a couple years ago when there was an issue of NSTAR spraying on rights-of-way to engage with NSTAR to discuss the use of pesticides on the Cape. And we came up with a 4-point plan that the county commissioners approved of several months back that had a mapping component to it that we had been working on for a year, and so that's complete now. So we've got, I believe, the most accurate maps of drinking water supplies in rights-of-way, certainly in the Commonwealth, if not in the country. That gives us a great deal of comfort as we go forward with whatever vegetation management plan NSTAR is looking to use out there, that we are protecting the drinking water supply. Secondly, we're engaged in a discussion about monitoring, putting some wells out there and taking a baseline of the quality of the water in these areas before any vegetation management plan takes place on the rights of way. And we're in negotiations with the Department of Agricultural Resources right now, DAR, on that monitoring piece. The third piece, though, which was crucially important, is an aggregation study. And that is an attempt to look and aggregate and come up with and quantify how much we're using as it relates to pesticides and fertilizers, because fertilizers also have an additional impact on the wastewater situation. So we're in the process of doing that now. We've scoped out that study at about $50,000. We have identified $15,000 of that. We're working with the Association for the Preservation of Cape Cod. They have 2 interns working on it. We've got an AmeriCorps person that's working on it, and we've approached and presented to the county commissioners last week. And they have put forward a supplemental appropriation for $35,000 to fund the rest of that study. So that we think that that's an important piece of this, which will lead to a matrix by which we can measure annually how much of this stuff we're using on the Cape, and then set regional goals to reduce that over time. So we're moving forward with that. And then once we have the aggregation study in play, and probably before we're completed in September, we're going to put together a citizens advisory committee around education and outreach on the use of pesticides also. So that's the 4th point, that education and outreach piece. So all that continues to move, but you'll be hearing more from APCC, and we want to thank the county commissioners for their efforts in front of the Assembly of Delegates in order to try to get us the remainder of that money to complete that study. So that's for your information. And then the final piece I want to mention is that after sort of an 8 or 9 month effort now, our new website is almost ready to launch. So I believe next week we'll be flipping the switch. And I want to thank Nancy Hosfeld for her work on that. She's worked tirelessly with our consultants in doing that. And from what I've seen, it's a great website. And all of the presentations that we make Cape-wide, you'll be able to access through that website now, and it should be a lot easier to use and user-friendly. So we will notify you by email when that is up and ready, and we encourage you to go to the website when it is ready and try to crash it. We got to test it out, make sure that it does what we need it to do. So that's it. Thank you, Mr. Chairman.
Thank you. At this point, I would ask for a motion to approve the minutes of the Cape Cod Commission meeting of July 7th, 2011.
So moved.
Second.
Moved and seconded. Any comments? Seeing none, all in favor?
Aye.
Opposed? Abstentions? One abstention. At this time, we will involve ourselves with a public hearing, Windriff Acres, final hearing, draft decision. I would have Michael read the hearing notice, please.
Thank you, Mr. Chairman, but I believe there's one piece of business that needs to be addressed quickly first.
If I may, Mr. Chairman, I need to recuse myself, so I will go sit in the audience for the length of this hearing.
Thank you.
Thank you, Mr. Chairman. I will read the hearing notice. Cape Cod Commission, Windrift Acres, August 4th, 2011. The Cape Cod Commission will conduct a public hearing on Thursday, August the 4th of 2011 at 3 p.m. in the 1st District Courthouse, Assembly of Delegates Chamber, Route 6A, Barnstable, Massachusetts. The following development of regional impact, or DRI, has been referred to the Cape Cod Commission under Section 13A of the Cape Cod Commission Act, Chapter 716 of the Acts of 1989, as amended, and Sections 3 and 7 of the DRI enabling regulations. The limited DRI review application was submitted under Section 13A of the Cape Cod Commission Act, as amended, and Sections 3, 5, and 7 of the DRI enabling regulations. This project will be considered for DRI or limited DRI approval. The purpose of the final hearing is to allow for proposed corrections to and comments on factual information contained in the draft written decision. This project will be heard pursuant to Section 13A of the Cape Cod Commission Act and Sections 3, 5, and 7 of the DRI enabling regulations. This notice is being published as required by Section 5 of the Cape Cod Commission Act. The project name: Windrift Acres. Project applicant: Peter Kopolis. Project location: off Slough Road, West Brewster, Massachusetts. Project description: a proposed 20-lot residential subdivision and 2 open space lots on 55 acres of land in West Brewster.
At this time, I would ask the chair of the subcommittee, Jack McCormick, to move on approving, I think we have 3 sets of minutes, 6:15, 6:23, and 7:21. One set? Thank you. What set is the one that we're moving on then?
7/21/11.
Thank you.
I will move the minutes of 21/11 as presented. Second.
Yes. Moved and seconded. Now, discussion. Yes.
Page 2. Page 2, the second paragraph from the bottom, Ms. Brookshire expressed a similar concern. That was not my intent. It's rather harsh. I'd like to have that taken out of the minutes. My concern was that the affordable housing be started at the same time, but not that the applicant make money without doing the affordable housing.
So page 2, which line are you referring to?
Second from the bottom, Ms. Brookshire expressed a similar concern regarding affordable housing and ensuring that the applicant is not making money off the project without doing the affordable housing component.
Are you requesting that be struck?
Please.
We have a change to the minutes. I would ask, I think we do another motion on that, don't we? Yes, I would ask for a motion on the minutes as amended.
So moved.
Chairman, I will change my motion to move them approved as amended.
Okay, so moved. Have a second?
Second that as amended.
Moved and seconded. Any discussion further? All those in favor, please say aye. Opposed? Abstentions? Okay. So moved. I would invite Andrea Adams to present the draft decision, please.
If I can get it to wake up. There we go. For the record, my name is Andrea Adams. I'm the Cape Cod Commission Senior Regulatory Planner. All of the commission members should have a copy of my PowerPoint presentation as part of this presentation. I will now go through it, assuming the equipment functions properly. Isn't that the way of modern technology? My PowerPoint covers the project description, jurisdiction, the standards of review, commission subcommittee analysis of the project, and conclusions. As was read in the hearing notice, the subdivision is of approximately 55 acres of land in Brewster. Copies of the site plans were provided as part of the commission members' packets who were not on the subcommittee. It proposes to create 20 house lots and 2 lots for open space. The parcel is currently vacant and wooded. It's zoned residential. It's an assemblage of several parcels owned by Mr. Copolis, the applicant. It will create a new subdivision road called Windrift Lane off of the existing road called Slough Road. In terms of the commission's jurisdiction, it's a development of regional impact, or DRI, because it is under Section 3C of the enabling regulations, and you can see the direct excerpt right here. It proposes to divide parcels of land totaling 30 acres or more in common ownership or control on or after September 30th, 1994, including the assembly and recombination of lots. Subcommittee held hearings on the 15th and 23rd of June, and a meeting on the 21st to go over the draft decision. In terms of the limited review, this is a relatively new process that was incorporated into the Commission's enabling regulations to allow subcommittees to determine the scope of review under the regional policy plan. It's covered in Section 5 of the Commission's enabling regulations. As part of the checklist, or as part of the limited review process, there are 2 scoping checklists, one for redevelopment and one for new development. Because the site is currently undeveloped, the scoping checklist of questions for new development was used. And the way it works is that a commission subcommittee is impaneled and can determine whether or not to include regional policy plan or RPP issue or sub-issue areas based on the questions in the scoping checklist. An area would be like transportation. A sub-issue area would be stormwater. So they can pick and choose. In addition to looking at those scoping checklist questions, the subcommittee can also consider the quantitative and qualitative impacts of the project on the resource areas protected by the Commission Act and Regional Policy Plan. Ultimately, the project was scoped for the Regional Policy Plan issue areas of water, wildlife and plant habitat, open space, solid waste management, and affordable housing. That's the order in which they appear in the regional policy plan. The subcommittee determined this scope by a public hearing on the 15th, and they confirmed that by a vote on the 23rd of June. Conversely, they can exclude from review a regional policy plan issue areas or sub-issue areas if the scoping questions on the checklist don't apply, and they can also consider, again, the qualitative or quantitative impacts on the resources to be protected by the Commission Act and Regional Policy Plan. The subcommittee found that certain regional policy plan issue areas did not require DRI review because, and this is a direct quote from the enabling regulations, no substantial deviation from the minimum performance standards, or there was no significant impact on the purposes and values identified by Section 1 of the Act. The excluded regional policy plan issue areas are land use, economic development, coastal resources, wetlands, transportation, hazardous waste management, energy, heritage preservation, and community character. Again, as I noted earlier, the project is a development of regional impact. The standards for review and approval are in Section 7 of the enabling regulations, and these are the criteria. They are consistency with the Commission Act, with the Regional Policy Plan and Minimum Performance Standards, or MPS, consistency with any applicable districts of critical planning concern, or DCPCs, consistency with municipal development bylaws, with the local comprehensive plan, and that the probable benefit of the proposed development must be found to be greater than the probable detriment. And one of the ways the subcommittee looked to determine whether the project had any potential benefits is to the best development practices, or BDPs, in the regional policy plan. I'm just going to cover the issue areas that were included in the scope, the first of which was water resources. It's in a wellhead protection area and a potential public water supply area. Those are two different water resource overlay designations created by the regional policy plan. It's also in the Brewster Water Protection DCPC. In terms of nitrogen loading, that's keyed to its location in those water resource protection areas. In terms of the potential public water supply area, the regional policy plan gives the controlling water district the ability to indicate to the Commission that it does not wish to use the project locus for public water supply. In your package, you should have a letter from the Brewster Water Commission dated May 20th of this year, so stating that. Because the controlling water district released the potential public water supply area designation, the nitrogen loading level changed from 1 part per million to 5 parts per million. The marine embayment was also looked at, that is Herring River, and a monetary contribution to address what's called a TMDL, or total maximum daily load of nitrogen, is based on the total flow of the project. That's articulated in Minimum Performance Standard Water Resources 3.5, and the subcommittee voted to adjust the mitigation to $88,000. That particular minimum performance standards leaves it to the Commission members to, in their discretion, adjust that contribution up or down from a 0 all the way up to what would be the maximum amount of $20 based on the project's flow. They chose to vote to adjust the mitigation to $88,000, and this is articulated in those two water resources conditions in the decision. The next sub-issue area in water resources is stormwater and turf management. The applicant provided a draft low-impact design landscape management program, a written narrative, and a conceptual landscape management plan. Both were found to meet the relevant minimum performance standards based on those documents and other materials. Ultimately, the subcommittee chose to condition the project relative to various water resources minimum performance standards. That includes the ones that are noted here with checks next to them. Condition 1 seeks to locate private wells relative to the on-site wastewater treatment system. That's to ensure that abutting wells are not impacted by the nitrogen flowing out of that system, because even though it is an advanced nitrogen removal system, it does not take that nitrogen to 0. Condition number 4 requires review of final drainage plans by Commission staff. Conditions 5 and 6 obligate an inspection to be done of the stormwater system to ensure it was installed as designed. And condition 7 is a limit on hazardous materials for emergency power due to the wellhead protection area, or WHPA. Note that that designation can't be lifted. So the next issue is wildlife and plant habitat, wetlands. It was mapped as significant natural resource area per the RPP map due to rare species. The scoping checklist, however, indicated that it does not trigger any of the questions. There are no vernal pools or wetlands on the site per the applicant's natural resources inventory, or NRI. This is inconsistent with minimum performance standard 1.5. Again, there are no vernal pools. And this is memorialized in finding number 8 of the wetlands and plant habitat section. And also it's consistent with MPS 1.6. There are no invasive species per the natural resources inventory. Again, this is memorialized in that finding that's shown on the screen. And ultimately, finding wetlands number 1 indicates that wetlands was not included in the RPP scope. A related section of the greater natural resources cluster is wildlife and plant habitat. Again, it's mapped as significant natural resource area due to rare species. And the project was found to comply with all of these minimum performance standards. They provided the natural resources inventory. It is going to be a cluster subdivision. It minimizes developed area and protects open space contiguous to other open space. The applicant also consulted with the Natural Heritage Endangered Species Program with respect to the rare species. It's associated with Elbow Pond, which is actually across road and on the other side of the site. And that letter in your packets from Natural Heritage on the 11th of April of this year determined that the project would not result in a take of rare species. And the findings describe the conformance with the plant and wildlife minimum performance standards. Again, they provided the inventory. There are no specimen trees. The project's been designed to reduce fragmentation of habitat, and the rare plant species and animal species are associated with Elbow Pond. On open space, again, a lot of this is driven by its designation as rare species habitat. Minimum performance standard 1.1 talks about cluster subdivisions as a way to protect open space. Open space is required at a rate of 2 times the developed area. For this project, that's 15 acres. The proposed open space for this project is 40. So it's the subcommittee found it's in compliance with this minimum performance standard. Nevertheless, it's also been conditioned to conform to those important minimum performance standards. One is to permanently protect the open space prior to conveyance of lots from covenant or building permit. That's very important to ensure that when and if the lots are built, that the owners, because this particular developer is not actually going to build the houses, but that the subsequent owners of the lot know what the exact boundaries of their lots are and don't stray into the protected open space. The option is to donate the open space either to the Brewster Conservation Commission or a qualified entity. That includes organizations such as Arenda, Barnstable Land Trust. I think Brewster has a land trust. So there are a number of any other organizations in addition to the town that could hold the restriction. On solid waste, the subcommittee determined that the solid waste management sub-issue areas should be included in the scope. That the project should do this because it may substantially deviate from the regional policy plan. The project is likely to generate a significant amount of land clearing waste because the entire site is currently wooded. And solid waste review was found to be important to ensure that land clearing wastes were appropriately dealt with. And this is dealt with in a condition of the decision, development of a waste management plan prior to a building permit. On affordable housing, which is one of the key areas, Brewster does not have an inclusionary bylaw, and it was also scoped for review under sections AH1 and 2 of the RPP. Section AH3 was found to be not applicable because it relates to commercial projects. This is a residential project. In terms of the relevant minimum performance standards, they're shown on the screen. For subdivisions, it's 10%. For this project, that means 2 affordable housing lots. The subcommittee found that donation of 2 lots, 7 and 17, addressed those 2 minimum performance standards. That's memorialized in finding AHF1, and that there are also other requirements to meet. That includes when the units will be ready, the mix of units, the size of units, that the affordable units are integrated into the overall subdivision. That's why 7 and 17 may have been chosen by the applicant, to spread them out within the 20 lots. The pricing and permanent affordability of the units will have to be dealt with, and also monitoring. This is all addressed in finding AHF2. In terms of the other applicable sections in affordable housing, they were found to be not applicable, and that's shown on the screen. It was also conditioned to conform with minimum performance standard section AH1. Specifically, the entity to receive the 2 affordable house lots must be determined, and that compliance with the relevant minimum performance standards will be the responsibility of the entity to receive those lots, including timing, mix, size, integration, pricing, permanent affordability, and monitoring requirements. The recipient of the lots could be the town of Brewster or a qualified entity. Qualified entities in this case could include Housing Assistance Corporation, Habitat for Humanity, or Community Development Partnership, among others. In terms of, again, the findings for approval, I've just gone through consistency with the regional policy plan and the act. The enabling regulations also state that the commission must find the probable benefit of the proposed development is greater than the probable detriment. And again, they may consider the BDPs, or best development practices, in that analysis. The subcommittee found that the project provides high-quality, naturally vegetated open space within a significant natural resources area, contiguous to existing open space that will be also publicly accessible. This is memorialized in finding general F6. And the other findings for approval include consistency with DCPC's, local bylaws, and with the LCP. In the case of these criteria, you have copies of these emails from Ms. Levin, the Brewster Town Planner, in the record and in your packets. In terms of the LCP, Brewster has a 1997 draft plan that isn't commission certified. Nevertheless, it encourages open space protection. So from the perspective of consistency with the LCP, it appears the project's consistent. Consistency with local bylaws is addressed in that specific email. The Natural Resources Protection Bylaw does not apply because the project filed at the local level before that bylaw was effective. And with the DCPC, household uses and subdivisions are generally exempt. This is a subdivision. However, it will still undergo standard town permitting. Overall, the subcommittee found the testimony indicates the project is consistent with the LCP and the Water Protection DCPC, and the bylaw does not apply, and these are memorialized in these findings shown on the screen. In conclusion, the subcommittee voted on the 15th at the public hearing to scope the project for limited review. The subcommittee voted again at its continued hearing on the 23rd of June to recommend approval of the project to the full commission with conditions. The subcommittee also voted at that continued hearing on the 23rd to direct staff to draft a written decision approving the project. That's the decision you have before you. They met on the 21st to review it, and ultimately they forwarded it to your approval. That concludes my presentation. I only have 2 small corrections to the draft written decision that was included in your packets. If you would pull that out, I will note the corrections for you. They are on page 34 of the written decision. They affect finding water resources F2. The finding currently reads, the Commission finds that the project meets or can be conditioned according to water resources conditions WRC1, WRC2, and WRC3 to meet the following general aquifer protection minimum performance standards under section WR1. The designation WRC3 should be stricken. And at the bottom of the page, you will find Water Resources Finding 3. In my copy, it continues on to page 35. And it reads as currently printed, the project is located in a Zone 2 wellhead protection area. The Commission finds that the project meets or can be conditioned to meet drinking water minimum performance standards under Section WR.2 by Water Resources Conditions WRC1, WRC2, WRC3, and WRC7. The reference to WRC3 should be stricken. Those are the only changes I have to the written decision at this time. Commission staff and myself are available to answer any questions you can have.
Thank you. At this time, I would invite the applicant to make their presentation, please.
Thanks. Thank you. For the record, John Eidman for the applicant, Peter Kopolis. Just want to thank Commission staff and the subcommittee for their efforts in the review and hearing and decision process. Andrea was very thorough. I would just add for the full Commission's deliberation that I feel this project meets the DRI approval standards, meets local development bylaws in the town, meets the call of the local comprehensive plan, and ultimately the project benefits outweigh the project detriments. Two ways you'll specifically see that within the decision is that there is open space over and above that required in a significant natural resource area proposed, 40 acres, it's almost 75%. Additionally, there is public access proposed in the open space that's not required. I'd suggest that's another substantial benefit over that which is otherwise required. So with that, I would be happy to answer any questions, but Andrea was very thorough factually, so I thank you for your time.
Thank you. At this time, we'll take questions from the Commission members. Are there questions? Seeing none, I would invite any federal, state, or local officials in the audience that would like to comment. Seeing none, I would invite members of the public to comment. Seeing none, at this time, I would ask for a motion to close the hearing and the record. It's been moved and seconded. Any discussion? All those in favor signify by saying aye. Aye. Those opposed? Any abstentions? So moved. At this point, I would move to approve the Windrift Acres subdivision project as a limited DRI with conditions. It's been moved and seconded. Any discussion? All those in favor signify by saying aye. Aye. Those opposed? Abstentions? So moved.
Mr. Chairman, if I may.
I have another motion. Go ahead, Roger. Would you like to make comment on this project?
Peter, if I may. Thank you.
Oh, there you are. I thought it was Roger.
I've been hiding down here. I'd just like to thank the staff and the subcommittee because it was my first venture as chair of a subcommittee. And I thought that the assistance from both the subcommittee and the staff was exemplary. Thank you.
Thank you. I have one more motion. I move to approve the draft limit DRI decision. Whoops, wrong one. I move to approve the limited DRI decision for the Windriff Acres subdivision project as amended. Moved and seconded. Any discussion? All those in favor, please signify by saying aye. Aye. Opposed? Abstentions? So moved. Thank you very much. And the next agenda item is a public hearing, Community Health Center of Cape Cod, Mashpee. Final hearing draft decision continued from June 28, 2011. I would ask the subcommittee to approve the 7/27/11 draft set of minutes.
So moved.
Moved and seconded. Any discussion? Seeing none, all those in favor, please signify by saying aye.
Aye.
Opposed? Any abstentions? So moved. I would invite Elizabeth Enos to present the draft decision, please.
For the record, Elizabeth Enos, Regulatory Officer with the Commission. I will be presenting on Mashpee Community Health Center, Project of Community Benefit, Hardship Exemption. Before I start, I just want to note that in your packets you have a letter from the Mashpee EDIC in support of the project, and that was received just about 2 days ago. So I updated the materials list in the decision. That should be the only change that was made. So I'll be reviewing with you the project description, Commission's jurisdiction, the procedural history, subcommittee determinations, findings for approval, and conclusions. Oops. The existing one-story, 9,900 square foot building is located on 4.65 acres of land that fronts Falmouth Road to the west and Commercial Street to the east. The property is owned by the town of Mashpee and leased to the health center in a 95-year ground lease. The proposed project consists of the construction of a two-story, 22,000 square foot addition to the west side of the existing building. It takes advantage of unique topography in that the second floor of the addition will be accessed from the current building. It will be designed to achieve LEED certification, and the expansion will provide necessary space to enable the center to meet the increasing demand of over 180 new patients per month. The Commission received the Project of Community Benefit Hardship Exemption application on April 14th, 2011, and deemed it complete on May 25th, 2011. The hearing period was opened by a substantive public hearing on June 28th, and subcommittee meetings were held on June 28th and July 27th, 2011. The project qualifies as a DRI under Section 3EII of the Commission's enabling regulations as an addition to an existing building that results in an increase in gross floor area greater than 10,000 square feet. The applicant applied for a Project of Community Benefit Hardship Exemption as it is a nonprofit organization pursuant to MGL Chapter 180. The proposed project will be providing access to a continuum of health and wellness services for over 5,000 low-income and underserved individuals, and the center enables clients to conserve their remaining resources to meet their basic needs, including housing. The subcommittee determined that the proposed project complies with the enabling regulations definition of a POCB, as it confers upon or results in distinct benefits to the community and citizens of Barnstable County, such as the provision of adequate capital facilities, balanced economic growth, and affordable housing, and it is consistent with sections 1A and C of the Act. Now I'll discuss the findings and conditions of the decision, beginning with land use. LU 1.2 requires development to be clustered on site. The project has been designed to cluster development to the extent possible in an industrial area and utilizes multi-story buildings and incorporates pedestrian-friendly design elements such as sidewalk connections to Route 28. As such, the subcommittee found that the project is consistent with this standard. Under economic development, MPS ED 1.3, the project is a redevelopment located in a town without a land use vision map, and it must meet 2 out of the 9 waiver criteria. The subcommittee found that the project meets 3 of these criteria, consistent with MPS ED 1.1 and E 1.3. They chose to meet green design as its LEED certifiable, and they are aiming for 49 out of 110 points. They're meeting emerging industry clusters, as it's a healthcare industry, and the municipal endorsement, as the Mashpee Board of Selectmen voted to support the project on April 11, 2011. For best development practices under economic development, the subcommittee found that the project meets BDP ED 2.2, quality employment opportunities, as it creates 12 new full-time and 7 new part-time jobs with wages that compare favorably to 2010 averages, and BDP ED 3.2, local ownership, as the health center is a 501c3 governed by a board of directors, and administration of the facility is done in the town of Mashpee. Under AH 3.1 and 3.5 in affordable housing, the required affordable housing mitigation is $219,114. The applicant received $6 million grant from the U.S. Department of Health and Human Services, and the remaining $3 million needs to be raised by the nonprofit applicant through a capital campaign. The mitigation will require an approximate 7% increase in the amount needed to be privately raised, and the majority of the health center's clients are those who would qualify for affordable housing. And by providing health care at a reasonable cost to a low-income population, the center enables clients to conserve their remaining resources to meet their basic needs, such as affordable housing. Therefore, the subcommittee granted relief from this standard. Under energy, the application materials demonstrate the project design is LEED certifiable. As LEED standards are more stringent than Energy Star standards, the subcommittee found that this satisfies MPS E 1.2 as well as MPS E 1.5, which requires on-site renewable energy. The detailed narrative from the project architect also demonstrates compliance with ASHRAE standards, thus meeting MPS E 1.3 as well. And as a condition for approval, prior to the issuance of a final certificate of compliance, the applicant shall submit to the Commission staff for review and approval a statement of energy design intent to demonstrate compliance with MPS E 1.2. Under natural resources and open space, the location of the proposed expansion is a relatively isolated patch of undeveloped woodland sandwiched between the existing building and the parking lot. The site will require some additional clearing and grading. However, these areas appear to have been minimized by virtue of the project's siting and design. And the project can be conditioned to meet MPS WPH 1.2 because of this. MPS WPH 1.1 requires a natural resources inventory. And the subcommittee found that the site is not located in a significant natural resources area and is effectively isolated from the remaining woodland. The habitat that currently remains likely does not provide significant habitat for the wildlife that may be utilizing it, and an NRI would be an additional expense for the project, and therefore the subcommittee granted relief from this standard. MPS OS 1.3 requires open space be provided for new development outside of an SNRA in the proportion equivalent to the area of new site disturbance. The applicant has calculated this area to be 0.9 acres, and to meet this requirement, the applicant would have to provide .9 acre parcel to donate to the town or provide a conservation restriction or a cash equivalent of $45,551. The applicant requested relief from this standard due to the expense of permanently protecting the open space, and the town submitted a letter of support for this request on May 11, 2011, and therefore the subcommittee granted relief from this standard. As conditions of approval, prior to issuance of a preliminary certificate of compliance, the applicant shall submit a revegetation plan that specifies revegetation of the disturbed area on the site with native species and to commission staff for review and approval. And prior to the issuance of a final certificate of compliance, the commission staff shall conduct a site visit to verify the revegetation plan has been implemented. Under water resources, the subcommittee found that the project can be conditioned to meet MPS WR 6.9 and 7.10, requiring an operation, monitoring, and compliance plan and a stormwater maintenance and operation plan. Under MPS WR 3.1, this requires that redevelopment is not to exceed the TMDL, or total maximum daily load, where one has been established. The fair share credit is the maximum load of nitrogen that can enter the watershed and not exceed the TMDL. As the project site is 4.65 acres, this results in a fair share credit of 2.42 kilograms per year for the site based on the allowable 0.52 kilograms per year per acre fair share credit. The expected load exceeds the fair share, and MPS WR 3.4 would require impacts to be offset by cash contribution equal to $101,262. And the subcommittee granted release from this standard based on the financial hardship that it would place on the project. MPS WR 1.1 sets a nitrogen loading standard of 5 ppm. The existing nitrogen loading calculations for the project indicate a current nitrogen loading level of 2.59 ppm, and a combined nitrogen load for the existing and proposed conditions is 3.86 ppm, thus meeting this standard. MPS WR 7.1 prohibits direct discharge of untreated stormwater, and the project meets the standard as well. The application materials indicate the design includes the use of 2 vegetated bioretention areas to handle the first inch of stormwater runoff, and emergency vehicle access will be constructed using reinforced turf, which should minimize additional stormwater runoff, and that allows the project to meet MPS WR 7.4. As conditions of approval for water resources, prior to issuance of a preliminary certificate of compliance, the applicant shall submit to commission staff for review and approval a revised tri-party agreement specifying future reports be submitted regularly, and revised stormwater system and inspection maintenance documents which address vegetation in the biofiltration areas. Within a year of receiving the final certificate of compliance, the applicant shall submit to commission staff a written inspection of the entire stormwater management system conducted by a professional engineer. Under hazardous waste, MPS WM 1.5 requires that any development or redevelopment that uses, handles, treats, or stores hazardous waste be in compliance with state regulations, and the subcommittee finds that based on the application materials, most of the waste generated by the health center are excluded from the RPP definition of hazardous materials and waste. As a condition for approval, prior to issuance of a final certificate of compliance, the applicant shall provide for commission staff review and approval registration or notification to Mass DEP as a hazardous waste generator, a written plan to manage the hazardous waste prior to disposal, and a signed contract with a registered licensed company to dispose of hazardous materials. Under solid waste and recycling, the subcommittee found that based on the application materials, the project is consistent with MPS WM 2.1, 2.2, and 2.3 dealing with construction and demolition waste. As conditions of approval prior to the issuance of the final certificate of compliance, the applicant shall submit to commission staff written evidence that the construction waste management plan was implemented, and the applicant shall implement its recycling policy for office paper and recyclable food and beverage containers to be consistent with MPS WM 2.3. Under heritage preservation and community character, the existing one-story building is located adjacent to Commercial Street, but the design helps to minimize the mass of the structure. The two-story addition proposed for the rear of the existing structure is so that the lower floor is located partially into the slope, such that the second story of the addition is the same level of the existing first story. And the area between Route 28 and the parking is vegetated and acts as a buffer to the existing development. Therefore, the subcommittee finds that the project design complies with HPCC 1.1, 1.2, 1.3, 2.8, 2.9, and 2.11. HPCC 2.7 requires that buffers be maintained to screen views from regional roadways. The expansion of the parking area will result in clearing of some of the vegetated buffer between Route 28 and existing development. The parking will be located only slightly closer to Route 28 than the current parking, and the new pedestrian access way is proposed to extend through the buffer area, and the curb design limits the views. Therefore, the subcommittee finds that the project complies with this standard. The subcommittee also found that the landscape plan is consistent with HPCC 2.10. However, as conditions of approval prior to the issuance of a preliminary certificate of compliance, the applicant shall submit to Commission staff for review and approval a draft landscape maintenance agreement for a minimum of 3 growing seasons to ensure vegetation is properly established. And prior to issuance of a final certificate of compliance, Commission staff shall conduct a site visit to ensure compliance with the exterior lighting standards. Under transportation, MPS TR 2.1 requires DRIs to offset 25% of the expected daily increase in site traffic. Based on the increase in average daily traffic of 756 trips per day, the applicant must reduce or offset 189 trips. The applicant has submitted a significant trip reduction plan in an effort to offset these trips, and the Commission allows for a 25% trip reduction credit for outstanding trip reduction plans. The subcommittee granted a credit of 62 daily trips, leaving 127 daily trips that would still need to be offset and require $315,600 in mitigation costs to comply with the standard, and the subcommittee granted relief from this standard based on financial hardship. MPS TR 3.4 requires mitigation of congestion impacts, and the applicant has calculated the mitigation to offset the project to be $134,646, consistent with MPS TR 3.6. The subcommittee granted relief from TR 3.4 due to the additional expense of providing trip mitigation, and the subcommittee found that the project complies with the remaining minimum performance standards in this area. As a condition of approval, prior to issuance of a final certificate of compliance, the applicant shall implement the trip reduction program that they included in their application materials. For best development practices in transportation, which goes towards the weighing of the benefits versus detriments, BDP TR 2.15 encourages applicant to provide bike racks and shower facilities. TR 2.16 encourages the applicant to provide trip reduction programs. And the applicant has provided an extensive trip reduction program offering alternative modes of travel and incentives for alternatives to automobile travel. And the subcommittee found that the project meets these best development practices and they are benefits of the project. In summary, the subcommittee determined the following relief could be granted without substantial detriment to the public good and without nullifying or substantially derogating from the intent or purpose of the act. $219,114 of affordable housing mitigation. The natural resources inventory requirement has been waived. $45,551 of open space mitigation. $101,262 of nitrogen loading mitigation. $315,600 of trip reduction mitigation, and $134,646 of congestion mitigation. The relief granted relates directly to the nature of the identified hardship and is the minimum necessary to address it, and a literal enforcement of the provisions of the Act and the RPP would diminish the care and benefits of the facility that they would provide, and it would necessitate cutting or reducing programs or services provided to the community. changes to the project and/or additional capital campaign fundraising. The subcommittee recommends that the project, with the relief granted and as conditioned, is consistent with the minimum performance standards of the RPP, local zoning bylaws. This was evidenced by the June 28th letter from the town planner, Mashpee's local comprehensive plan, which was also included in that letter, any districts of critical planning concern, and the probable benefits of the project outweigh the probable detriments of the project. And this is evidenced by best development practices ED 2.2, ED 3.3, TR 2.15, and TR 2.16. The subcommittee found that the project will provide care for those targeted in the RPP's affordable housing section. It will provide health and dental care to an underserved market. It will create jobs, utilize an innovative septic system, provide an outstanding trip reduction plan, and deliver approximately $210,000 worth of uncompensated care and approximately $384,000 worth of enabling services. It will also be designed to achieve LEED certification and is not located in an SNRA. The subcommittee found that these were benefits of the project, and in conclusion, they recommend that you approve the project as a project of community benefit and a hardship exemption. So if you have any questions.
Thank you. I would ask the applicant at this point to make their presentation.
Thank you. Good afternoon, Mr. Chairman and members of the Commission. For the record, my name is Liza Cox. I'm an attorney with the firm of Nutter, McLennan & Fish, and here this afternoon on behalf of the Community Health Center of Cape Cod. With me this afternoon is Mr. Dave Peterson. He is president of the board of directors for the Health Center. Karen Gardner, who is the CEO of the Health Center, and Christy Murphy, who's the project manager for J.K. Scanlon, who'll be doing the construction of this project. Before I get into my presentation in any length, I just wanted to acknowledge and thank Elizabeth for stepping in. We had the pleasure of working with Paige Zapiga pretty much throughout the hearing process, and she will be missed from the applicant's perspective and from a practitioner who practices before you guys. But I wanted to thank Elizabeth especially. It's not easy to come in after the public hearing and after 2 subcommittee meetings and step in and present in the way she did this afternoon, so I thank her for doing that. What I wanted to focus my testimony on this afternoon is why this is a project of community benefit, why the subcommittee found it to be one, and talk a little bit about the demand of this project within the community, which I think is very important. As Elizabeth mentioned, the Community Health Center is a Massachusetts nonprofit 501c3 corporation that's governed by a private and volunteer board of directors. Its purpose under its articles of organization is to increase access to health care for uninsured and underinsured people by providing a free clinic or system of free clinics as a charitable corporation. And its mission is to improve the health status of the patients and the community we serve through the provision of comprehensive, high-quality, compassionate health care to all, regardless of their ability to pay. This health center is one of only 1,200 community health centers across the country, and it is a federally designated qualified community health center. It provides primary and preventative health care to anyone, regardless of their ability to pay and regardless of their insurance status. Some of the services that it offers presently includes regular doctor's visits, case management for chronic conditions, dental care, behavioral health care, mental health care, counseling, family planning, women's health care, and prescription assistance. And with this expansion, it's going to be able to increase the amount of dental chairs from 3, which it currently has, to 10, provide for a low-cost pharmacy. It will allow for an optometry department, additional space for insurance counseling, which is one of those enabling services that Elizabeth mentioned in her presentation, and also expand the provision of primary care facilities within the center. There is a tremendous need for this project in our community. Since the health center was established in the last 14 years, it has evolved from what was a volunteer-free clinic that was only open 2 evenings a week to what it is now, and that is a comprehensive, federally qualified community health center that's open 6 days a week and 12 hours per day. Presently, this health center serves over 12,000 patients. Nearly 1 out of every 9 persons living within its market area relies on this health center for their health care. And as Elizabeth mentioned, it is experiencing a tremendous demand for increased services. Presently, it's seeing about 180 to 200 new patients every month, and it's having a difficult time meeting that demand given the existing 9,900 square foot building. There are serious space constraints that this expansion will enable the health center to meet that increased demand. Once the expansion is completed, it's anticipated that the number of patients it cares for will increase from 12,000 patients to about 18,000 patients. And when you look at the annual report, the latest annual report that the health center released, which is the 2010 annual report, you can see, again, the tremendous increase in demand. So when you compare 2009 to 2010, it saw, just in that 1 year, a 25% increase in total patients, 27% increase in patient visits. Medical visits were up 26%, dental visits up 19%, behavioral health visits up 74%, and the Family Resource Center visits were up 127%. As you may or may not know, Cape Cod has actually been designated as a federally medically underserved area, and that's as a result of a shortage of medical and dental professionals in our area, together with a significant number of people who are underinsured or uninsured also living within our region. Presently, right now, about 40% of the patients that come to this facility are below the 100% federal poverty level. 65% are below the 150% of the federal poverty level, and 87% of the patients are below the 200% of the federal poverty level. Finally, I just wanted to highlight some of the achievements that this health center has accomplished recently. Within the last 3 years, as Elizabeth mentioned, they've assisted nearly 5,000 individuals gain access to health insurance. They assist patients and families in obtaining free or low-cost medications. Since they've been in existence, they've achieved $1.5 million worth of low or free cost, medications for their patients, so that those patients wouldn't have to choose between groceries, healthcare costs, and housing costs. They've also connected hundreds of people to food stamps, veterans benefits, and other health insurance care. They've also annually deliver about $210 worth of uncompensated care, and again, annually about $384,000 worth of those enabling services, connecting people through the healthcare system, helping them navigate it, and helping them obtain insurance. One of the benefits of this project, one of the other many benefits of this project, and this was something that was highlighted when the health center applied to the federal government and received that $6 million grant of stimulus money, was that this project will help assist in the aid in the region's economic recovery. This influx of $6 million into our local government is very significant and a tremendous economic benefit. New jobs will be created as a result of this expansion, and those are high-paying jobs with very good benefits. In addition, construction jobs will be high with this project. It's going to be about $3.9 million in construction labor costs to build this expansion. One other issue or area that I wanted to highlight and thank, even though I don't see anyone here, is the cooperation with the town of Mashpee. As Elizabeth mentioned, this property is owned by the town and leased by the health center. The Board of Selectmen in Mashpee have been very supportive of this project. They have reviewed and endorsed these plans. In April of this year, they agreed to sign on as a co-applicant in this petition as the property owner, and the health center has been very grateful of that cooperative relationship with the town. To wrap it up, I think this is a tremendously important project for our community. It's benefiting a lot of people who really need these services. We're seeing $6 million of our federal stimulus money invested into our local economy, which I think we can all be very proud of. This health center, as expanded, is a cutting-edge design in terms of the way it's been architecturally designed, the LEED certification, and also it helps fulfill the health center's mission of providing comprehensive care to people who are medically underserved in this region. And finally, I wanted to thank the subcommittee very much for their time and efforts with this project. One of the conditions of the federal grant that the health center received was that the health center be up and operating in September of 2012. And given a 9-month construction period, that's a very aggressive time frame. We're I think, on schedule at the moment. We've already started discussions with the local permitting that's going to be required. And the subcommittee made tremendous efforts to really expedite the review process, and we're very grateful for that. So I thank you very much for your time. I ask that you support and endorse this important project, and our team is here if you have any questions for us. Thank you.
Thank you. I would invite now questions from the commission members.
Mr. Chairman, if I may.
Yes.
I'm not sure if it's a typo, but originally the review was 22,000 square feet and was later amended to 22,200 square feet.
What page are you on, Jack?
Now I'm looking at page 19, and it refers to, under transportation, to a development of 22,100 square feet.
I can respond to that if you'd like, Mr. Chairman.
Please do.
The size of the building is 22,200 square feet. When the original application was filed, the measurement wasn't taken quite in conformance with how you all define gross square foot, which is from the exterior of the outside walls. So throughout the decision, it should read 22,200 square feet.
So evidently that's a typo on page 19, where it refers to 22,100 square feet.
Thank you. We can change that. Any other questions or comments?
Mr. Chairman, just before I make a motion, I have a comment.
Yes.
And on behalf of the town of Mashpee, I'm very proud to have a project like this in town, and we welcome it.
Any other questions or comments from the commission? Federal, state, or local officials present that would like to comment? Public members that would like to comment? I would ask the subcommittee chair for a motion to close the hearing in the record.
Mr. Chairman?
Hold on just a minute. Time.
Sorry, a little late coming in here. I just wanted to say that having read everything that this project is going to bring to the community, it's just absolutely incredible. The impressive amount of different areas you're going to cover medically for the Cape is excellent. I saw the whole section on special care for women and getting veterans involved, because veterans do not have a medical facility on Cape Cod. They have the Hyannis Clinic, but it's not quite the same as what you are going to be able to offer. And otherwise, they have to go to New Bedford or Providence or Jamaica Plain. So that's really excellent. And I applaud you for what you're going to be bringing to the community. Thank you.
Thank you, Elizabeth. Joanne.
I was going to save this for later, but perhaps this is the right place to say that Paige and Elizabeth did an excellent job in leading the subcommittee. We were led by my friend to my left, and one of the things that I was impressed with was that the services, the medical services that are provided are so good that the facility has grown, but they're also on a fast track. And when they came to the subcommittee, and they looked for financial hardship. It isn't that we just say, oh, we're going to just grant them this hardship. They've raised, because out of 1,200 medical facilities, they're federally qualified for a grant. So that was, to me, a demonstration of how much work that they have done, and as Elizabeth has alluded to, the kind of services they're providing. And they still are on the fast track, and so they are raising some private funds in addition. And so the hardship, in my mind, was a good vote in order to help them and also to fast track. And the subcommittee met very swiftly and quickly in order to come before the full commission, that we are sure that will follow our direction and pass this. Thank you.
Thank you. I would allow other commission members to comment if you would like. Seeing none, I would ask the subcommittee chair for a motion to close the hearing and the record.
Mr. Chairman, I move to approve the Mashpee Community Health Center as a project of community benefit.
Hold on, Ernie. We need to close the hearing and the record first, so if you would move that to close the hearing and the record. That's okay.
Motion to close the hearing and the record.
Moved and seconded. Any comments? All in favor, say aye. Aye. Opposed? Abstentions? So moved. Now, a motion, please.
I was jumping the gun because I was excited.
You should be.
I move to approve the Mashpee Community Health Center as a project of community benefit, DRI, hardship exemption with conditions.
It's been moved and seconded. Any further comments? Seeing none, all in favor, say aye. 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 Opposed? Abstentions? So moved.
Mr. Chairman, I move to approve the draft project of community benefit DRI hardship exemption decision for the Mashpee Community Health Center as submitted or as amended.
Moved and seconded. Comments? Any comments? Moved and seconded. All those in favor? Aye. Opposed? Abstentions? So moved.
Mr. Chairman.
Yes.
I know you already did this, but I want to thank Paige, wherever you are, who's done a wonderful job as usual, and Elizabeth, who now has her feet wet, and is going to do a wonderful job, I'm sure. The rest of the staff, those folks over there who presented it and did such a great job from the Community Health Center. Elijah, like you always do, and our chair, who's the best leader in the world. Thank you.
I don't know if I can take that. That's great. Okay. At this point, is there any other business for the commission? Seeing none. Now is the time for CCC member comments. Yes, Joanne.
Thank you, Mr. Chairman. I wanted to thank Clay Schofield and Glenn, and Tabitha has been working on it but not present. We went before the Sandwich Board of Selectmen and made a presentation on our ongoing project for bikes, and the reception by the Board of Selectmen 2 Thursday nights ago was extremely supportive and very interested. So we're still working on our bikes, which is from the marina, to 1:30, and see what happens. But I was very proud of those who work for the commission. Thank you.
Thank you.
Chair?
Yes, John.
I just have a question of the executive director. He had mentioned that the mapping of the areas that are under the power lines that NSTAR is in control of, do they plan to use this mapping information as part of their defoliage strategy?
The short answer is yes. So we've done the mapping project, so that information is available to the towns now. So when NSTAR goes forward with their integrated vegetation management plan, whatever form that takes, they will notify towns in January of their yearly operating procedures, their YOP, and then the towns can comment on that. So now the towns can use our maps to provide comment, and we're making our maps available directly to NSTAR, so we anticipate that they will be using them.
Further comments?
Will we adjourn, Mr. Chairman?
Moved and seconded. All in favor? So moved.